My name is Kelly Garcia. I am the Policy Lab Director at Ideas 42. Welcome to our second virtual event in our Policy for Shared Prosperity speaker series, Reducing Administrative Burdens to Rebuild the Safety Net. We have three wonderful speakers today who are going to talk about how administrative burdens show up, how they harm people experiencing chronic scarcity, and steps we can take to reduce those burdens so we can start creating a social safety net that works for those who need it most. Our speakers today include Pamela Hurd, a professor of public policy at Georgetown University. Her research focuses on equality, inequality, and how it intersects with health, aging, and policy. She is the co-author, along with Donald Moynihan, of Administrative Burden, Policymaking by Other Means. Darren Liedl is a seasoned financial coach, tax professional, and racial wealth equity advocate. He is currently an entrepreneur with Ideas 42 Venture Studios. His work with low to moderate income families has focused on long-term financial goal achievement and wealth building. He most recently launched a successful consulting business focused on addressing wealth inequality and led projects in partnership with social enterprises, including Propel, government partners like the New York City Office of Financial Empowerment, national and local nonprofits, including Prosperity Now and Catalyst Miami, and educational institutions, including CUNY's School for Professional Studies. Erica Hansen is a staff attorney with the Health Law Unit and the Legal Aid Society in New York City, where she represents clients on a variety of healthcare issues, including access to and navigation of public health insurance, healthcare benefit and service denials, and reduction and elimination of medical debt and Medicaid overpayments. Erica uses her on-the-ground experience to advocate for informed and equitable policy change through local, state, and federal legislative and administrative advocacy, systemic litigation, and grassroots cooperation. So before I turn the presentation over to our speakers, I do want to say a few words about Ideas 42 Policy Lab. So at the Policy Lab, we apply insights from behavioral science to advance public policies that promote equity and well-being for everyone, but with a focus on those policies that are most important for people experiencing poverty, and Black, Brown, and Indigenous people, people with disabilities, and people from communities who have faced historic discrimination. We are working towards a more just and equitable world, one where people have the resources they need, not just economic, but also political and social capital to lead lives with dignity and autonomy. One piece of starting to do this work is trying to bring researchers and academics into conversation with policy advocates so we can begin building both the research base and the knowledge that we need to advance those policies. And that's part of what today's policy series is about. And with that, I will turn it over to our first speaker, Pam Hurd.
Hello, thanks so much for having me. I am going to talk about administrative burdens. So administrative burdens broadly are these sort of difficulties that we encounter when we're trying to access really any kind of interaction with government, but we're going to really be talking about it, I think, today in the domain of social welfare policy. And parts of our social welfare policy system are kind of ridden with these burdens, these obstacles that people face when trying to access key government benefits and services. And the work that I've done with my colleague, Don Moynihan, we developed basically a way to talk about these burdens in terms of different kinds of costs. And part we do this because we think it's a little bit easier to think about interventions if you can kind of break it down into different categories in terms of the kinds of costs that people encounter. So the first set of costs are learning costs. So these are learning, compliance, and psychological costs, which I'll walk through in a minute. I do want to preface this briefly by saying, however, that administrative burdens aren't always bad per se. So for example, if you think about requirements to document your vaccine status, right? That's sort of a burden that helps because we do sort of better ensure that people are, for example, actually vaccinated. But the cost basically is considered relatively low to the benefit. So it's thinking about sort of relative costs and benefits of these kinds of burdens. So the first set of costs that we identify are learning costs. This is about engaging in search processes to collect information about, in this case, public services, including how to get benefits, as well as actually to how to stay on government programs. So it's not just getting on a program, it's staying on a program, like food stamps, for example, or Medicaid. So that process of like recertification. So the example that I'm going to give you here is, this is Abel Sewell. He's a 6-year-old boy in Tennessee who was on the Medicaid program. And he was recovering from cancer, or in remission, I should say, from cancer, and was receiving monthly treatments and received his benefits through the Medicaid program. He and his mom show up at the doctor one day for his regular checkup and find out that they are no longer enrolled. He's no longer enrolled in the Medicaid program. His mom had no idea why. What happened basically is that Tennessee realtered its recertification process. They effectively just sort of mailed out 50 to 60 page forms to families. If you didn't get the form, if you didn't fill it out, or you filled it out incorrectly, you were just thrown off the program. His mom didn't actually get this packet of information. And in fact, this is a huge problem for low-income folks. I know there's a lot of advocates on the line. People move a lot, so you can't, we often don't know actually where they are. And this is actually exactly what happened to Abel. It took them a year to get back on the program, and it was really only the intervention because of the media highlighting of his story that he got back on the program. And effectively, somewhere around 200,000 children in Tennessee lost coverage during this period. Missouri did something similar. This is a good example. It's both learning and compliance, but it's definitely learning costs, like literally no idea they never got the form, right, for recertification. Mechanisms to reduce these costs are broad. We can think of everything from really investing in outreach, either directly via government services, making ensure government is like in regular contact with people, basically to ensure that you have updated addresses. If you're talking about recertification, if you're talking about just getting people on programs, doing extensive and broad advertising, as well as engagement with the kinds of folks on this call, actually, in terms of nonprofits who engage in these communities. Government, though, can also use administrative data to its benefits. So I know someone's going to be talking more about tax benefits, but the IRS, for example, around 1 in 5 people eligible for the earned income tax credit don't receive benefits. There may be ways, actually, the IRS could be doing better outreach to trying to get people on the program who are eligible for it and not receiving benefits. The second category are compliance costs, and these are kind of what we typically think of as red tape. This is the paperwork you have to fill out. It's the forms that you have to put together. It's the documentation you have to generate. These are incredibly onerous. There's rich evidence that these have huge impacts and take up programs, everything from Medicaid to food stamps to the earned income tax credit. Some of the key, and this is evidence-based, some of the key barriers in terms of compliance costs, asset tests are huge. They're incredibly complicated. They're never straightforward. There's lots of variance in terms of what actually does and doesn't count as assets, how you count it. I looked up forms, a booklet one time in in Arkansas that gave state bureaucrats a manual to tell people how to count assets for the SSI program. It was 110 pages long. The second, in-person interviews tend to be super problematic in terms of a compliance cost. Lots of evidence about how those reduce program take up. So interventions that tend to work really well are automating recertification processes to the extent that states can do this. You just automatically re-enroll programs when you have administrative data, for example, on folks. Reducing or expanding, periods of recertification also helps. Cross-program linkages are huge. So for example, if you enroll in the SSI program, in most states you're automatically eligible for Medicaid, and in some states that's nearly automatic enrollment. That's another huge reduction in compliance costs. And generally what we find here is that for really complicated programs, nudges, sending people texts, for example, does not work really well. What does work really well is either the sort of automation of processes, or the other approach is to just provide people with really intensive supports to help them navigate those complicated programs. And last but not least, here are what we call psychological costs. This is the stress and frustrations that people encounter, and oftentimes fear. If you can imagine how Abel Sewell's mom felt, the little boy with cancer in Tennessee, just the profound fear that people experience in these circumstances. This was during the pandemic. A friend of mine actually was texting me about her niece who was laid off from her waitressing job. She's got her 5-year-old in the other room. She spends hours trying to put together eligibility packets for Medicaid and SNAP. And then everything just is tossed out when she's trying to upload it. And she talks about this feeling like they just make it impossible to actually get assistance. And that sense you hear over and over and over again, documented in media accounts that people have documented, that people experience in media accounts. We also see this in qualitative studies on this topic. Now, we'll hopefully at some point talk in a bit more detail about it, but I did want to put this out there that the Biden administration actually has issued 2 different executive orders and some rule changes around some existing laws, particularly the Paperwork Reduction Act, with the key goal of actually reducing burdens in programs funded by the federal government. So this can be programs like Social Security Disability, which is really run by the federal government, but it also applies to programs like SNAP or Medicaid, which are sort of jointly run by states and the federal government. So they're putting a lot of energy, the Biden administration, into doing this. And I do want to add, in the most recent guidance around the Paperwork Reduction Act, actually, they specifically mentioned psychological costs, that government programs kind of need to take this seriously, basically, when they think about adding, for example, a new burden to a program, not just taking into account how long it takes people to navigate that or how much they might have to pay to provide documentation, but they also need to document these sort of psychological costs that people encounter. In a big picture sense, when we think about people's views of government, whether or not people trust government, this really matters. We spent trillions of dollars basically on aid during the pandemic, like nothing, or rarely like nothing, that we have ever done before. And it was incredibly generous on the one hand. We have real evidence that it substantially improved people's income security. But on the other hand, a lot of people's experiences of that were burdensome and negative, and people were kind of left with a bad taste in their mouth. And that's not really what we want to happen when we have people encounter government programs, in part because it affects people's support for those programs and their willingness to engage to try to maintain them. So these are just other snapshots of the other executive orders, which we can talk about more later. But in conclusion here, basically what I want to say in a sort of big picture sense, we talk a lot about take up of government programs like SNAP or Medicaid or EITC. And with EITC, for example, we often talk about, oh, it's great. We have 80% take up. And compared to TANF or traditional welfare, that's maybe 40 or 50%, that sounds great. But if you compare it to a program like Social Security retirement benefits, it's 100% take up for that program. And in my mind, that's the goal. There's ways we can achieve it. We can get nearly perfect take up for these programs. And that should be the goal that we're aiming for. And we need to make the federal government take more seriously when they're doing cost benefit analyses of any kind of additional program requirements, that they take seriously and really calculate these costs relative to whatever benefits they think they're getting from these additional burdens. So I will stop there and pass along to our next participant.
All right, hi everyone. I'm Darren Liddell, one of the entrepreneurs from the Venture Studio. Today we're going to be talking about administrative burdens in regard to tax and wealth building. I'm specifically going to focus on the EITC look back. So y'all get ready to learn about let's go on a tax journey together. Next slide, please. All right, so in my quick presentation, I'm going to first tell you a little bit about the Ideas 42 Venture Studio. From there, we'll dive into the EITC look back and talk about who's impacted by it, and give a few examples that I saw this past tax season, as well as I'll kind of finish with some final thoughts on administrative burdens on the whole. Next slide. All right, next slide again. So let's talk about the Venture Studio. So just kind of a quick heads up, this is a newer thing. So I wanted to make sure to clarify. Ideas 42 has a new Venture Studio that focuses on helping companies to build businesses that solve massive social challenges, typically using tech and with a kind of focus on scaling. So I'm currently in the process. I'm in the second cohort, currently trying to build a business that focuses on wealth building, targeted towards lower income folks. And what exactly that will be, I'm not able to share just yet, but I know that there's some exciting things coming. As well as I'm looking to work and incorporate my prior experience with VITA, EITC, child tax credit, financial coaching, benefits policy, and more. So just a little primer about me. Next slide. All right, so next let's dive into the look back. All right, so the basics of the EITC look back. So for those who are a little bit less familiar, when the pandemic happened, the kind of a law was passed to let taxpayers use their 2019 income to claim on their 2020 and 2021 taxes the biggest earned income credit possible, with the kind of thought being incomes have changed drastically. Many folks are claiming unemployment. The economy has been impacted. We don't want folks that are counting on this big tax refund money to be also impacted there. So this kind of look back rule was built into the tax code and able to kind of help folks, for a temporary time. So this was a really, really nice benefit that was available to folks. But what's difficult about it is you have to know that you need to claim it, or your tax preparer has to know that you need to claim it. And in addition to that, you've got to have your 2019 AGI or your prior year return with that information when it comes to tax time. So it's quite easy to miss, especially for those that don't know that they should be looking for it. So with that, next slide. All right, so how did we see this impacting people on the ground? So I speak mostly of my VITA experience in Brooklyn. I live in Brooklyn, work at a VITA site a few miles from my house. It's great. But I'm going to tell you guys about Flo, and then you can also look at the information from Mia as well. So Florence came to our tax site. She came in this year, 2022, to do her 2021 taxes. She came in, we prepared her taxes, finished the return, and we're like, hey, Flo, your return looks like it's going to be about $5,299 between your state and your federal. And she immediately was like, whoa, hold on, that's a little lower than it's been in the past. Just want to make sure you guys didn't miss anything. And we said, that's great, good point. Let's take a look. So, I, as the quality reviewer, kind of went and looked at her return and saw, oh, okay, it seems like you might qualify for the EITC look back. You're a mom of 3, you've got, it seems like you received a large amount of unemployment this year, much more than you would have in a normal year. Normally, Flo made about $8,367, but this year, most of her income was unemployment. She has a newborn, so that explains why most of why she wasn't able to work as much as she would have in other years. So all this to say, after we ended up putting in the look back for her, she ended up getting a refund that almost doubled. It was around $10,284 that she received exactly. And I'll kind of preface this to say, not everyone got refunds as big as Flo's, but for those that did, of course, it was a big impact. And for those that didn't, even if it was 200 or 300 more bucks, that still makes a huge difference for folks on the ground that really, really need that money and are counting on every dollar, both of their tax refund and of their income, to make it count. Next slide. All right, so at our site, we saw that the average refund increased to around $2,500. This is an approximation. And we saw that around 5% of taxpayers were impacted. So it wasn't everyone who came to the site at all, but for those that were impacted, they were often really happy to hear that the refund was going to be bigger. And then when we explained to them why, they were often like, can we also make sure we're getting this on our 2020 taxes? And that I was able to receive that as well. And in many cases, folks received both years, or we did an amendment for their prior year if they hadn't done that tax year yet. Next slide. All right, so who's most impacted by this earned income tax credit look back? So what we saw is single parents who have yet to return to work for a variety of reasons. Most of our clients are single parents, but there were some individual taxpayers as well that just didn't have families or filed single. In addition to that, those that received unemployment, we kind of saw that as one of the biggest red flags for us. Is if someone received unemployment in this year, but they didn't receive it in 2019, it's very likely that they qualified for this credit. In addition to that, taxpayers that kind of flagged for us that the refund seemed a little low or lower in comparison to other years, that typically was a red flag for us to double check to see if the look back qualified for them. Next slide. All right, so what did we do? So me as both a tax preparer and like an advocate in the community, as I started doing taxes this season and saw that some of our preparers weren't catching it across our sites in Brooklyn, kind of was like, okay, look, we need to raise awareness about this, both locally and then also see if we can raise awareness at the national scale. So locally, what we did is kind of like create a quick checklist for folks to use in the community to know that they were qualifying for that their clients likely qualify for the lookbacks, the intake, the kind of members of the tax site could use that, kind of screen these clients, kind of flag, maybe look back eligible, write that on the tax documents, and then pass them off to the tax preparer, who would then take a look and make sure and see if they qualify for that. In addition to that, nationally, we drafted a blog post in partnership with the folks over at Prosperity Now and IRS Spec, just kind of raise awareness in the field and let folks know that this exists. And although it got a lot of media attention the prior year, in this tax year it got a little bit less, but please don't forget about it. So this is a kind of a screenshot of that blog post. And one other little fun fact is, if you're looking for this blog post, if you Google EITC look back, it's the first result. It's the result with like the preview text in Google, which is really neat. So y'all can take a look at that when you get a second. Next slide, please. All right, so what can be done to make this easier on families? So, the way this list kind of starts for the IRS section of this is, best case is EITC look back is automated. I think Pam talked a lot about automation playing a really key part of making access to benefits as easy as possible. So where IRS has all the data they need on the back end to do this, they could automate this and let folks know, like, hey, we checked, you qualify for this, you're going to get a bigger refund, here's why. Kind of a lesser version of that would be to send letters to eligible families and tell them, looks like you may qualify for this, just flagging this, see your tax preparer, see if there's something that you can do, or use these services to file your own taxes online and make sure that you're getting this credit. And the last thing is, and I want to talk about this as a really key part, is advocating for the IRS to receive more funding. So, something that we've seen a lot is IRS has been burdened with more and more things to do as an organization over time, especially in the pandemic, distributing stimulus checks, distributing CTC, but their funding hasn't increased very much, if at all. In order for them to do the best job that they can, they also need more funding as an organization to both hire new people, create new roles, and make sure that, kind of their online tech is operating as efficiently as it can be. And then from the perspective of tax preparers and kind of the software side of things, is for those that are making tax software, just making it as easy as possible to really flag for taxpayers that looks like you're eligible for this, or you may be eligible for this, or for the preparers that are using your software, like take a look and make sure you're not missing out on this opportunity. It's quite easy to miss in the tax software that we used at our tax site this tax season. So I wanted to kind of flag that. And then again, automation where possible, where somebody did their tax in 2019, they come back, pulling forward that information to make it easy for them, for the preparer to access, or for the client to access that automatically. Next slide. All right, so a few interesting programs to check out that are doing really interesting work in the space that I wanted to flag for y'all. The first is Let Get Set. They're a organization that focuses on helping households to maximize their tax credits, and will kind of humanize the process of, are you sure if you received the biggest tax credit you possibly could, making that a little simpler. In addition to that is Get CTC, which is by the folks at Code for America. They've worked with the White House and Treasury to kind of be the source for folks that don't typically file taxes to get all the tax credits and benefits that they're eligible for. And the last is Get Your Refund, and they partner with the folks at United Way Worldwide run this site, and partner with the folks at TaxSlayer to offer free tax filing for folks that make under 73K. But what I like about Get Your Refund is that it's kind of flat versus most of it's easy to understand versus most of the IRS free file program sites. Can be a little complex. They work for some folks, don't work for some others. This is just if you make 73K, you qualify. Next slide. All right, so some quick thanks to folks that I worked with to get the data and put the presentation together. Folks at Go Brooklyn, which was the local VITA site that I volunteer at. Folks at Prosperity Now, which helped with the blog post, and the folks at IRS Spec helped to kind of provide feedback both on the blog post and just kind of making sure that we're elevating things to kind of the VITA field more broadly. So a quick note here, IRS's logo isn't here because they're have strict rules about logo usage, but know that they were supportive of the presentation. Next slide. All right, cool. So my last slide is going to focus on quick thoughts on administrative burdens for y'all to just kind of keep in mind. So the first thing is, can we make benefit access as simple as possible? So see, the child tax credit was an example of this, where the attempt to make it as simple as possible was more effective than it was not, but there maybe can still be a bit more to do. CTC was mostly an opt-out program, so families receive this benefit automatically, but because for a few different reasons, many folks were not automatically opted into it. Maybe they hadn't filed taxes in a while, maybe IRS didn't know how to reach them. And for those folks, the burden to receive it was much higher, but for many folks, especially for those who file taxes regularly, they were able to receive it without a hitch, and that's great. Another thing to keep in mind is like user experience and the tech behind it are both really important. I think a lot about pandemic unemployment, and right at the start of the pandemic, when many things were uncertain, unemployment portals were overwhelmed with people looking to receive their services, and folks having to wait weeks or months to like enroll and then actually receive that benefit. Just kind of keeping in mind that I know this was like a rare case, but keeping in mind that we've got systems in place to make it as easy as possible for folks to use systems that do exist. And the last insight I'll just kind of say is that behavioral insights can play a key role. And I think the focus ideas for you do a good job of kind of elevating like here opportunities to use behavioral design and to kind of like make the best case and make it as easy as possible for folks to enroll in programs, as well as just kind of listening to users and letting them tell us what's working really well for them. Is really, really important, and kind of listening to those folks on the ground. Anyway, with that, I'm going to wrap up. Thank y'all for listening to my quick spiel. I know I speak quickly, so thank you for listening quickly as well. I'm going to pass it over to Erica, who's a staff attorney at the Health Law Unit for Legal Aid Society.
Thanks so much, Darren, and thank you all so much for being here. I know that there is a lot going on right now, to say the least, and I appreciate you all being here to talk about this important topic. So I'm going to be talking about reducing the administrative burden in healthcare, mostly focusing on public programs, because that's where my work centers. So we're going to talk about accessing benefits, focusing on churn, and accessing services. So prior authorization will be the focus of that part of the presentation. So I just wanted to highlight one article to kind of center like my perspective, and I think a good perspective, this Time Tax by Annie Lowry in the Atlantic. It focuses a lot on a lot of what Pamela was talking about, and she's interviewed in the article as well. But I think it really humanizes what a lot of us that have been on public benefits, assist people with public benefits, practitioners day in and day out experience, right? And it also highlights kind of a lot of the areas in which we can do better, right, in documenting these burdens. So I think this is a great read if you haven't read it, and I suggest it. And so as we kind of do a deep dive into the policies, just keep in mind that the focus really is kind of the people here. And my focus is about making public benefits more usable, more reflective of everyday life of people. Next slide, please. Okay, so the first issue is accessing benefits. So we can talk about Medicaid and CHIP churn, and I'm sure many of you are familiar with this issue. So what is it? So this is when a beneficiary loses Medicaid and CHIP and then re-enrolls within a short period of time, right? So they're churning in and out of the system. And these rates vary by state from 5 to 15%. But what is kind of astounding is that 10% of the entire Medicaid and CHIP populations disenroll and then re-enroll in a year, right? 4.2 within 3 months and 6.9 within 6 months. So that's pretty ridiculous. That's a lot of people getting kicked off and re-enrolling, right, in a short period of time. So it's a big problem. Why is this happening? Pamela talked a little bit about this, but it's hard to navigate that renewal and redetermination process, right? And that can happen in some states, every 6 months, every 12 months, monthly. And a lot of states do periodic eligibility checks, right? So they're just checking in between renewal and redetermination processes to see if people are still eligible, sending them notices that they need to respond to. And if they don't, they get kicked off. Or if they do and they're no longer eligible, they get kicked off. Other reasons are just kind of the way of life of working people, and especially the working poor. So income fluctuations and changing family circumstances, right? So, You make more in one month than you do the next month. You might make overtime. You may be a seasonal worker. You may lose your job, gain other jobs, etc. These are just very, very common life circumstances for working people, and specifically, lower income working people. And then, a lot of people lose coverage because of a failure to transition to marketplace or employer-based coverage for their ineligible months, right? So a lot of those life transitioning then your health insurance is very difficult. So what are the consequences here? So periods of uninsurance for individuals, delayed care, less preventative care, and higher individual health care costs. And then there's consequences, for the state, for the government as well, higher administrative and healthcare costs, and there's less predictable state expenditures. And you can see why, right? People are constantly moving on and off, on and off. Next slide, please. So what are some solutions to this problem? Well, we have a great case study right now. So with the Families First Coronavirus Response Act, or FCRA, something called continuous coverage protections were implemented. And that means that anyone who had Medicaid or gained Medicaid since March 2020, March 18th, 2020, was unable to be kicked off of Medicaid, except for very narrow circumstances, moving out of the state, actively closing your case, or passing away. So churn was reduced considerably, right? Because people could not lose Medicaid during this time. And so there's been studies about the fiscal and enrollment implications that I've linked to here, which have been good, right? A lot of people have stayed on Medicaid. And for the states, because they received a higher amount of money from the federal government for doing this, they've actually made money from this arrangement. But there's still kind of some open questions that we have, like, did it improve access to care for people? Did it improve the lives of people? So these are things that I think we know as practitioners, but it would be helpful to kind of dive into that in more detail. So another solution are ex parte renewals. So it's really important to remember that states are required to attempt to renew Medicaid eligibility using all available data sources, so without contacting the beneficiary. And this applies both in the MAGI population, which is that expansion population, the 19 to 64-year-olds who don't have Medicare, and the non-MAGI population, right? So that traditional SSI related or disabled, aged, and blind, whatever your state may call it. Both of those populations, states are required to attempt ex parte renewals. And just because that's a requirement does not mean that states are doing it. So advocating for more ex parte renewals is really a great way to take that burden off of individuals of, filling out all of the forms, figuring out, what their income and assets were, for the past year or month, or however your state does it. Right. So here's some strategies to increase the ex parte rate from Manat Health. So you can expand the income data sources that your state is looking at, right? And there's some examples there. You can also use, and I think Pam mentioned some of these, automatic waivers for people who are enrolled in SNAP, using express lane eligibility and facilitated enrollment spas for other populations, right? If you qualify for other programs, you can automatically qualify for Medicaid, right? So you're not doing more than one application and renewal cycle. Let's make it easier for the people having to face these programs, okay? 12-month continuous coverage is another great solution to churn. 32 states currently provide 12-month continuous coverage for children in Medicaid or CHIP, and 4 states provide them for at least some adults. So there's a lot of room for improvement there. And as part of the coronavirus public health emergency unwinding, right, when that's going to end, the federal government is encouraging a lot of states to take advantage of 12-month continuous coverage. That means that at no point in time during 12 months after you've been found eligible, Can you lose coverage because of income changes? So that really reflects the way people live their lives, as I was saying earlier. Okay, and then it's some administrative changes, extending renewal periods, multiple modality application and renewal. That means let people renew over the phone, online, right? Not just in person or on the paper applications. Account for anticipated income changes, and improve communications with enrollees, right? You can do data matches with the US Postal National Change of Address database. So when people move, the state or the county, whoever administers Medicaid, knows that, right? And can move with them so that they get the notices. Next slide. Okay, so in terms of accessing services, one of the biggest burdens that we see is prior authorization or prior approval. So having to get approval from your plan, your health insurance plan, prior to getting your services. So I kind of use this pyramid so you can see, like, if there's the whole pool of people needing services, by the time you get through the prior approval process, the people actually getting care is a much smaller percentage of that population, right? So these are kind of the steps that you have to go through. You have to find an in-network provider. You have to actually get your provider to submit the prior authorization request. A lot of times we see that providers don't want to deal with that, especially with the Medicaid population. Like, it's just not worth the paperwork for them. Then you have to get your insurance company to actually approve the service, right? Get through that prior approval. If you don't do it, then you have to do an appeal, maybe a second level appeal if your first appeal is denied. And provider participation is really important in those appeals. And so if you don't have that, right, these are all levels that people may self-select out, like say, I can't do this, I'm just not going to get care, I'm going to pay out of pocket if they can do that, right? Or they're just straight up denied and they don't get the services they need. Next slide. So here's some more statistics and information about prior authorization and prior approval. It's a really big problem. This OIG report found that in a survey of Medicare Advantage plans, that 13% of the prior approval requests in the survey that they did, in the sample that they did, were improper, right? That they should have been approved. It was medically necessary services. And generally, physicians say that prior authorizations have a negative impact on patient outcomes. And research has found that patients are more likely to discontinue services when prior authorizations are required. Next slide. Okay, so finally, what are some solutions for the prior authorization problem? Let's actually get people the care that they need and their doctors say they need. Well, a lot of states actually waived prior authorization requirements because of the COVID pandemic. And these waivers can be made permanent. States don't have to go back to what they were doing prior to the pandemic. So a lot of states said, like, we don't want you to go through the difficulty of getting your prescriptions refilled during the pandemic. We don't want you to go through the difficulty of getting your physical therapy or your occupational therapy. So we're going to get rid of these PA requirements that we had. Those can be made permanent. Another solution is to, reduce the wait times and streamline processes. So I've given you some examples here of what happened in New York and some of the suggestions that they had. Something as simple as, like, let's do electronic submission instead of mailing and faxing, right? Let's actually post the clinical criteria, right? So doctors and patients can access it. This Michigan bill shortened the time period in which a plan actually has to make a decision. And then CMS is also commenting on this issue. And I just wanted to flag one evolving area is data sharing. There's a lot of opinions on this in terms of patient privacy. A lot of providers are saying, you know, if we share our data with the health plans, we've actually noticed that there's more denials of prior approval requests. So that's kind of just a flag where there's lots of different opinions. All right, and that's all I have. So I will send it back to Kelly. Thank you.
Thank you so much, and thank you all for these great presentations. So before I open the forum up to questions, I just want to say a little bit more about our work at Ideas 42 and how we are thinking about policy change. So our research has shown that when you take steps to reduce or ameliorate administrative burdens, you can increase the number of people who can access services. And as Darren said, when we are thinking about government programs, particularly those that are going to help people living in chronic scarcity, policymakers need to be focused on keeping the application and administrative processes as simple as possible. Now, we also know that for a host of reasons, policymakers often do the opposite of that. And in fact, when people, they add more complexity for people, for programs that primarily serve people who are experiencing chronic scarcity. So as advocates, we need to put pressure on policymakers to reduce administrative burdens, and our speakers have given us a lot of good ideas on how to do that. And as our speakers also noted, we also need to make sure that the programs that are administering our safety net programs are fully funded and have the funding that they need to administer these programs. The administrative burdens fall both on the individuals that are experiencing them, but also on the programs themselves. And too many burdens can keep them from being able to help people enroll. So with that, we're going to move to questions. You can drop any questions that you have into the Q&A. And I'm just going to take the prerogative of being the moderator and kick us off with a question to everyone. What is the one thing that you would like to see from policymakers when we think about building a safety net that works for everyone? Just let me know who wants to hop in and take that first question.
I can go ahead. My 2 cents. I think a couple of there's sort of a broad point, and then I think some micro thoughts. Like the broad point, I think, is to just get policymakers to take this seriously when they design programs. So there's a lot of interest, right, in oftentimes tightly targeting programs. You know, if you think about the student loan relief, for example, that people have been kicking around, the idea that you would dismiss 10,000 and then they wanted to put an income threshold on it for people only, you know, people earning below, I can't remember if it was 150 or 100,000 a year. And on the one hand, you get why that makes sense. On the other hand, it's a very, very small fraction of people who will be above that threshold. And by doing that, you will slow it down for everyone else. In fact, you probably, tons of people probably wouldn't get the benefit as a function of putting that criteria in place, given challenges the Department of Ed has had in the past administering this kind of stuff. So that's like the big picture thing. I really wish policymakers would take more seriously when they add these layers to these programs. And then the second thing, I think I just mentioned some very specific things. Asset requirements, in-person interviews, just are killers. And I just reiterate Darren's point about maybe this big picture, really about taking these agencies more seriously that deliver these programs and giving them budgets that allow them to administer them effectively. Because neither the Social Security Administration at this point or the IRS, as Darren mentioned, have sufficient capacity, sufficient budget.
I'll jump in real quick and say, so I thought about this question from 3 different lenses. From the tax lens, I thought like increase funding to IRS. And then I also thought like things IRS can work on is like better portals for people. Like a lot of folks know this, but IRS mostly communicates with folks via letter. And if you lose a letter, it's really difficult. And calling IRS is really difficult. So like, if reaching the IRS is burdensome, like the online systems that they have to be better so that folks can engage with them safely and securely and quickly. So, all this to say, like, funding would likely address many of those other problems. And then from the like kind of wealth building and benefit lens, I've been doing some user research interviews recently for my project, and folks have been saying a lot about like retirement and savings and like wanting it automated, as well as like wanting incentives, kind of where they can. So, thinking from like what folks need, but also like making it easy for them to like opt into and receive those programs. Yeah, I think a lot about like MyRA, which was like a IRA program that government had for a while, but went away for a bunch of different reasons. But there are things that we can do to make it easy for folks to access things that will help them in the long term. And then lastly, on the kind of benefit front, easy enrollment and recertification is something that I think a lot about. I think about like during the pandemic times, and still for some states, folks are able to recertify their SNAP benefits and get them without having to go to an office, without having to fill out a form. They just were automatically renewed. And of course, we saw program enrollment increase significantly, or it's like maintain its high rates, because folks didn't have to go through that burden of recertifying. So are there ways that we can either reduce the amount of time folks have to certify or make it as easy as possible when they do?
I'll just add on to what Darren was saying, like right now is the time to really be pushing on, what he was saying, because right now is when all of these agencies are talking about going back to pre-pandemic times. The phrase is called, unwinding, right? And that's literally what they're calling it. And so, I mean, we really need to think about that. Why do we want to go back to, all of these burdens and all of these systems that didn't work, when for 2 years, we've been doing something that works much, much better for people, right? And so really highlighting, how it's been better for people, why it's been better for people, why it's been better for states, and saying like, let's not just put back in the previous policies that weren't working for people. Right. And now is the time to do it. States are putting together their plans for the Medicaid unwinding right now. For example, California just put out a really good plan, but they're planning on putting back in their prior authorization requirements. Right. They're putting back in a lot of these things that are really, really bad for people who are on benefits. So as advocates, like this is the time for us to be really loud about this.
Thank you. I want to I'm going to try to combine a few questions that have come through that are, a lot you've already talked about, and people have mentioned in the comments that a lot of the complexity in benefit design stems from these means testings and compliance measures. Given how hard it is to get policymakers to give up on the means testing and the compliance measures, what are things that we could do to reduce the bandwidth cost of the measures, or other things that you think we could do that we could chip away at the edges, given kind of the intransigence with many of the policymakers?
So I love this question, in part because and I know there are people who are going to say, what, when I say this, it's not really means testing that's the problem exactly. Like every single policy has burden built into it. So if you look at the Social Security retirement benefit, for example, that is an incredibly complicated program. You have to keep track of people's earnings for 35 or 40 years, their full lifetime. The benefit calculation is actually quite complicated. The issue is basically where do you put the burden? Do you put the burden around this stuff on the state or on the individuals? And then there are parts of means or income testing that are more complicated than others. So like the asset test, for example, honestly, it's nearly impossible to reduce burden in that. That's why I'm really opposed to those, because there's no way. Income, on the other hand, honestly, we have tons of administrative data that can make it really straightforward to do certain kinds of income testing. My comment about that, about the Department of Ed, was it's just that the Department of Ed, for whatever reason, and I'm not saying it's their fault, has just really struggled to do any kind of benefit administration effectively. So it's more about getting policymakers to think really strategically about how they use this and ways to shift burden to the state, basically, from my.
I think one of the important things to highlight in means testing is the disparate impact that a lot of means testing has. So when I think of asset tests, I think a lot about how things like owning a home does not count as an asset, but cash assets count as an asset. So who does that disproportionately affect? It disproportionately affects the people who have been locked out of owning a home and need cash assets in order to rent, right? So when we're talking a lot about these means tested programs, if we want to attack them, I think there's other ways to do it maybe than just focusing on the burden, which is really bad. But there are underlying reasons for a lot of these means testing, and a lot of them are racist reasons, and a lot of them have racist outcomes. So I think highlighting that for something like an asset test might motivate some other people that don't want to take administrative burden head on to take on an issue where they otherwise wouldn't.
I'll add on really briefly. So I was looking at some data around this kind of state asset test recently, and was like, I guess pleasantly surprised. My expectations were very low. I was like, wow, many states have actually like increased the amount that people of assets that folks can have. But that's still to say that like they're still too low and still really hard for folks that they're really hard for a bunch of different reasons. So I guess my kind of quick thoughts are, is there a way for us to just, to show as a field or to advocate kind of as a community that like, here's why we think this is bad, and here's how, here's the good that can come from us, kind of working together on this and having really targeted issues or really targeted timing of kind of outreach to policymakers. Because I feel like I think we all kind of agree, many of us on the call kind of agree that these things should change, but I don't think that oftentimes we're coordinated enough in our efforts to make the change, so that it can be, kind of happening at the same time.
So Erica, I wanted to follow up on something you said, and that comes from one of the questions that we got submitted prior to the webinar, which was the root cause of many administrative burdens is really prejudice and mistrust. So how do you build a safety net system of trust in people?
Yeah, I think a lot of that, honestly, is storytelling, which Pamela did at the beginning of her presentation. I highlighted that article that talks a lot about who the people are, right, that are accessing these benefits. And one of the things I like about the time tax is that it contrasts the benefits that higher income people access, right? There's so many benefits that higher income people access, like we're talking about Social Security, retirement, but it's all automatic, right? So there's all of these benefits that are all automatic for a lot of us that are, reading about this, a lot of the decision makers in the rooms, and contrast that, with the people who are burdened, like Pamela was saying, like who carries the burden for this. And so I do think it is like storytelling, it is humanizing people to make people like really see what the quantification of this is like. That's why I like that article so much, because you can really just like feel what it's like to be on public benefits and trying to go through that system. I think if we had more of a quantification, that would be really, helpful as well.
I'll chime in really quick and say, if folks on the call haven't seen the Netflix show Made, I think it does a really good job of like demonstrating what it feels like to be on benefits. And like deal with legal systems and have scarcity and just have kind of a lot going on. So, highly recommend check out that episode, check out that show. Also, brace yourself for an emotional heart wrencher, but it's very good. And then the next thing I wanted to say is, in addition to storytelling, is like powerful data usage. And I think about this. So I like, my background's in financial planning, and I was in a class with something like 20 financial planners. And in that class, we were talking about public benefits and benefits for high income earners versus low income earners. And you could just see that like almost everyone in the class thought that like high income earners have no benefits and low income folks get all of the benefits. And I feel like that tends to be like the narrative that many folks come from, are like folks just have no idea. And many of you on the call, I'm sure, have done this, where you're like in the room with the policymaker, they know zero about your issue and you're educating them. So just kind of making sure that we're starting from ground zero and kind of finding ways to kill these assumptions with good data and storytelling.
Darren, could you just repeat the name of the Netflix show that you were citing?
Yes, it's called Maid, as in someone who comes to clean your house kind of thing.
I believe there's also a book if people read, prefer to read instead of just watch. Okay, we are out of time. I'm going to actually squeeze in just one quick last question. So we appreciate everybody for sticking on. I'm combining a few questions here. So one of the questions we got was, how do you compute the return on investment of these efforts? And I want to add to that question, Pam, based on something you said, is like, how do you measure the cost to people people for not being able to get the benefits, or the cost of applying to the benefits? It goes beyond the economic cost, the psychological cost that you talked about, because I feel like that's important when we're thinking about what our actual return on investment is. It's not necessarily going to be just the straight monetary one-to-one.
Yeah, it really isn't just a straight monetary. I mean, one thing that's super interesting about this new guidance from the Biden administration about the Paperwork Reduction Act is basically that it actually clearly lays out precisely what agencies are supposed to think about when they evaluate like a new kind of administrative requirement they add to a program. So it's time, for example, like how much time do people spend? But then it's also how much money do people spend actually paying for the paperwork, for example, like if you need to pull medical records for disability, someone was asking about disability benefits. So it actually lays out a fairly precise list of things that they should be thinking about. Generically in the literature, I think the weakest area that we have in terms of figuring out how to measure this stuff actually is the psychological costs. I have some research around this that's actually trying to use experiments and kind of physiological measures. But I think we actually have a long way to go in terms of like just from a pure research side, in terms of figuring out how to do that. I would say though, honestly, people who employ qualitative methods do an incredible job. Carolyn Barnes, who was at Duke, who does research on WIC and SNAP and Medicaid now actually too, has just amazing interviews with people trying to navigate these systems that you can kind of get a better feel for that. And to the point that both Erica and Darren made about storytelling, that kind of research is just incredibly effective at kind of relaying how it actually feels to navigate this stuff.
Well, thank you all so much for taking the time to give these wonderful presentations. We really appreciate all the information you shared. We will be sending out a link to the recording of the webinar, and we also can send out any materials and information that's helpful to all the registrants. And finally, I just want to say that we do have our next webinar coming up, which is very timely based on some of what we've talked about, which will be breaking the cycle of chronic scarcity by removing resource limits for public benefits programs. And that will be on July 26th. So please, Amanda has put a link in the chat to that if you want to register to it, and we'll be also sending out the information there. Thank you all again. Thank you, Pam, Darren, and Erica. We really appreciate this.
Thank you.